So Heather Woodbeck and myself, Ebo McDonald, the long-term care best practice coordinators for the Champlain and the Northwest LHINs, would like to welcome you to our second part of this three-part series on best practices in oral care. Today we'll be discussing oral health assessment in long-term care, unhealthy changes, and common abnormalities in the mouth. Please note that this presentation was previously recorded. There will be time for questions at the end of the presentation. You can do that in one of two ways. You can either type into the chat box, or at the end of the session, we'll unmute the phone lines and you can ask your question. We'd like to answer all your questions, but we've also provided you with a link that you can use and go to where we'll put all the questions for part 2 and answers as we were repeating these sessions frequently. I would like to thank Kendra Ward and Sophia Christian for presenting today. So I'd also like to acknowledge the partnership between RNAO and the Long-Term Care Best Practices Program and the Dental Hygiene Program at Algonquin College. Funding for this was both through the Long-Term Care Best Practice Program, the Ministry of Health and Long-Term Care, and through an Algonquin College Initiative Funding Grant. I'd really like to thank all the students that helped to prepare for this presentation and all their dedication and hard work towards this, and to recognize Angela Noel for her leadership and coordination for this oral care partnership.
The objective of this presentation is to describe unhealthy changes and common abnormalities in resident oral health status. We will include a quick review of normal so that you can understand the changes that are happening in the resident oral health status. Background. It is important to remember the steps involved in completing an oral status assessment, including all components of the mouth: lips, gums, tissues, palate, teeth, debris, tongue, saliva. The goal is to identify injury and infection in order to monitor healing, treatment, along with quickly identifying oral cancers. The presentation will be organized into sections mentioned above. Lips. Normal lips should appear pink and moist to slightly dry. Some common changes include cracked or fissured lips and angular cheilitis. Common abnormalities include canker sores and cold sores. Cracked, fissured lips. Cracked or fissured lips are common findings and can be recurrent if an individual is a mouth breather. If cracked or fissured lips are recurrent, it may be a sign of difficulty breathing. The lips will appear dry and shallow to deep cracks. Some causes of cracked or fissured lips include dry or cold weather, licking the lips too much, and dry lips in general. If left untreated, the affected area can become infected and painful. Angular cheilitis. Angular cheilitis is inflammation and irritation affecting the corners of the mouth. It is commonly seen in elderly individuals, and it may be painful and cause difficulty eating. The cause of angular cheilitis may be due to a deficiency of B complex vitamins and an overgrowth of yeast. Angular cheilitis initially appears as chapped lips at the corners of the mouth and progresses into red lesions. As the condition progresses, it becomes more and more painful. Canker sores. Canker sores are another name for aphthous ulcers. They appear as white lesions surrounded by a red halo. Canker sores can be very painful and cause difficulty eating. They can appear on the lips, but are also seen in other areas of the mouth. There are a few causes of canker sores, some of which include injury, food sensitivity, stress, or a weakened immune system. Canker sores are not contagious, but when they recur frequently, further investigation is required. Cold sores. Cold sores appear as clusters of multiple fluid-filled vesicles that eventually rupture, leaving ulcers. The ulcers become crusted in the late stages and can be very painful. The cause of cold sores is the herpes simplex virus 1. It is important to note that cold sores are very contagious and easily spread to other areas of the mouth or to other individuals. Any cold sore in the mouth should resolve within a week. Here you can note the different images relating to common abnormalities of the lips. Teeth. When teeth appear normal, they are even in color and have visible roots. wear, and restoration. Common problems with teeth include broken teeth, loose teeth, and cavities. The image provided is an example of what normal teeth might look like. Broken and cracked teeth. Broken or cracked teeth may be noticed as they will appear different in size and shape than other teeth in the mouth. A brown line may be visible on the tooth. Image 1. Broken or cracked teeth can be more common in seniors. Aging teeth have a smaller nerve and fewer blood vessels and less nerve tissue, leading to less fluid content, making them brittle and more prone to breaking or cracking. The enamel of teeth gets thinner with age, which weakens the tooth structure. Other causes of broken or cracked teeth can be a result of the weakened tooth structure, including biting down on something hard, trauma, decay, or old fillings that can no longer support the tooth structure. Image 2. This image shows a cracked front tooth. Sometimes cracks can be hard to see in a tooth and appear as hair-thin fracture. Image 3. This image shows two teeth broken at the gum line. Loose teeth. You will not usually notice a loose tooth. They may only be visible during eating, talking, or if the resident pushes it with their tongue. There are several factors that can contribute to loose teeth. Loose teeth can occur from periodontal or gum disease, causing the bone to resorb around the tooth. If a resident presents with a loss or with a lot of recession, which is the shrinking of the gums, the teeth may also be loose. Trauma, such as a fall, and also tooth clenching and grinding, which puts excessive force on the teeth. In this case, the teeth will look worn down. Caries, cavities. Dental cavities are the destruction of tooth from bacteria and plaque. Bacteria on the teeth break down foods and produce acids that destroy the tooth structure, resulting in a hole in the tooth called dental caries, also known as a cavity. Arrested caries occur when the destruction process has halted and the cavity does not need to be restored. Arrested caries appear as broken black stain on the tooth. Common area for decay in seniors is near the gum line. When the gums recede or shrink, the roots are exposed. The roots of the teeth are not protected by enamel, which makes them more prone to decay. Some contributing factors of caries include a diet high in sugar and starch, poor oral hygiene, and dry mouth. Debris, plaque. Plaque is a mixture of food debris and bacteria that builds up in the mouth, and it can be wiped off. If it is not normal to have an abundant amount of debris on the tooth. If buildup persists, it will form into calculus, a chalky white or stained hard substance, which is commonly known as tartar. Tartar needs to be removed by a dental professional at regular oral care appointments. Image 1 is an example of mild debris accumulation. In image 2, you can see a moderate debris accumulation. Image 3 is severe debris. And in image 4, this is where the plaque becomes hard tartar, also known as calculus.
Gums. Healthy gums should appear pink, firm, and moist in all areas of the mouth. Some common abnormalities of the gums include abscesses, gingivitis, and periodontitis. Gums with an abscess on them will appear swollen or round-shaped, pimple-like, red, filled with pus, and could be painful. In a mild abscess, image 1. Here we see a small abscess that has slight redness around it with a clear white center. Image 2 is an example of a moderate abscess. In a moderate abscess, the pus is very obvious and inflammation and redness around the area will occur. At this point, the resident will most likely be in pain. Image 3 is an example of a severe abscess. In a severe abscess, the abscess will appear extremely large and swollen. Image 4, the swelling will be visible from the outside of the resident's mouth. The symmetry of the resident's face and or neck will be different. Gums Gingivitis. Gingivitis is an inflammation of the gum tissues due to an accumulation of plaque bacteria on the teeth and beneath the gums. If gingivitis is left untreated, it can progress into periodontal disease and/or tooth decay. Gingivitis is reversible with proper oral hygiene techniques such as brushing and flossing. Depending on the severity of gingivitis, it can appear red, shiny, inflamed, bleeding, and/or tender. These signs may vary depending on the severity of the gingivitis. In image 1, we have an example of mild gingivitis. This is a photo of someone with mild gingivitis. The gums around the teeth are slightly red and inflamed. There isn't a significant amount of plaque on the teeth, but because the gums are red, it is apparent that there is some plaque under the gum. Image 2. Moderate gingivitis. This is a photo of someone with moderate gingivitis. As you can see in this photo, there's a significant amount of plaque around the teeth and gums. The gums are extremely shiny and inflamed and red. Bleeding will occur while brushing and flossing this resident's teeth. Image 3. This is a photo of someone with severe gingivitis. The gums are extremely inflamed and puffy. This person's gums are probably very sore and tender to touch. While brushing and flossing this person's teeth, there will be a significant amount of bleeding. Periodontitis. The appearance of periodontitis includes, but is not limited to, the following characteristics: red or purplish swollen gums, tender or bleeding gums, receding gums, or longer appearing teeth, and noticeably loose teeth. Some other symptoms the resident might present with are bad breath or a bad taste in the mouth, sensitive teeth to either hot or cold foods or both, and pain upon chewing. Just looking at the gums of this person's mouth, not the teeth, it is an example of healthy, pink gums that do not look inflamed and therefore firm. In image 1, this is an example of mild periodontitis. In the beginning, milder stages of periodontitis, usually color change in the gums and inflammation and bleeding are present. Recession may also be present. When a person is in this stage of periodontitis, it can be difficult to diagnose because the visible signs are often the same as gingivitis. Determination of the difference between gingivitis and the beginning stage of periodontitis could only be determined by a dental professional through certain examinations. Tooth mobility is usually not yet present at this stage. Image 2 is an example of moderate periodontitis. This picture represents a person who has progressed from mild periodontitis to moderate periodontitis. With periodontitis, each person's mouth can look very different from the next person in the same stage of the condition. However, some common characteristics of this stage that you can see include uneven or bumpy-looking gums. Sometimes the gums may look very pink, such as in the picture, but it does not necessarily mean that they are healthy. They can also appear very red. The gums don't fill the spaces between all the teeth, especially on the bottom right side of this person's mouth. This is caused by destruction of the gum tissue and bone. You can also see the recession, which exposes the root surfaces and are distinguishable by a yellow, darkish appearance. Teeth with spaces between them and roots exposed, such as the two on the bottom right of this photo, likely will also be loose. Image 3 is an example of severe periodontitis. This photo represents an advanced or severe stage of periodontitis. In this photo, the gums are pinkish red and bumpy and swollen looking. They also appear smooth and shiny and like they would bleed very easily. The roots of almost all the teeth are very visible, which represent severe gum tissue and bone loss. These teeth would likely be very loose. Palate, floor of the mouth. Palate and floor of the mouth. A torus or tori are variations of normal and are fairly common, painless, bony, hard masses, as seen in the first assessment webinar. They have no malignant potential and they can happen on the floor of the mouth or on the palate. Rashes are talked about in the RYNDS, but in dental hygiene we refer to rashes as irritations. Stomatitis is a very broad term and it can affect anywhere in the oral cavity, including floor of the mouth, although the most common area is the hard palate. Caused by local infection, systemic disease, a physical or chemical irritant, or an allergic reaction, it is usually seen in the aging population. Stomatitis can be asymptomatic, or residents may complain of halitosis, slight bleeding and swelling in the involved area, or a burning sensation. In image 1, we see mild stomatitis. It can be identified visually. As from the previous presentation, pink is normal. Here we see some red and white pronounced spots that are not normal. Image 2 is an example of moderate stomatitis. It is red, puffy, it exemplifies red, puffy irritation and inflammation that is unhealthy, while we still see some pink in this remaining healthy tissue. Image 3 is an example of severe stomatitis. This picture shows a lot of inflammation, and all of the tissues on the palate are red or a variation of red. Here we see the progression of stomatitis. Tongue. Normal findings on the tongue include pink color, racial pigmentation, taste buds of various sizes, fissures, and scalloping on the outer borders. Common changes include a coated tongue with different levels of severity. Common abnormalities include candidiasis and glossitis. A coated tongue will appear with a white substance on the surface that can be brushed or wiped off. A coated tongue is a major cause of halitosis, which is bad breath. The cause of a coated tongue is a mixture of bacteria and or fungi mixed with dead cells that accumulate and get stuck between the taste buds on the tongue. Candidiasis. Candidiasis will appear as a thick white substance coated on the tongue that cannot be wiped away. It may also be accompanied by red patches. The cause of candidiasis is an overgrowth of yeast that can cause this infection. This is a very common oral manifestation of antibiotics because yeast have an opportunity to thrive when there is less bacteria present. Glossitis. Glossitis will appear as a swollen, smooth, red tongue. It is often very painful. The cause of glossitis can be from dry mouth, trauma, low iron, some systemic diseases, or allergic reactions. Saliva. Normal amounts of saliva in the mouth will give the appearance of wet and pink tissues. Saliva is normally serous, which is slightly on the watery side. Xerostomia, commonly known as chronic dry mouth, occurs when there is reduced salivary flow. This is considered abnormal dry mouth that is very uncomfortable. This occurs when the resident is immunocompromised or is taking medication that can cause xerostomia as a side effect. Image 1 is an example of mild xerostomia. In the mild stages of xerostomia, there is still some saliva present, but certain tissues will have a glossy appearance from being dry. The tongue will also appear glossy and have a slight presence of a white coating. In image 2 is an example of moderate xerostomia. In moderate xerostomia, saliva will be thick and have a stringy appearance. A white coating will also appear on the tongue, cheeks, and gums. Image 3 is an example of severe xerostomia. In severe xerostomia, there is no saliva present. The tissues and tongue will have a very dry appearance and be shiny and red from the lack of hydration. Oral cancers. It is extremely important to check all over the oral cavity for oral cancer as it can show up in multiple areas as seen in this picture. Areas to check include under the upper lip and upper gums, lips, inside of the cheeks, inside of the lower lips and lower gums, roof of the mouth, the back of the tongue, underneath the tongue, and the sides of the tongue. The most common areas for cancerous lesions to develop are the sides and underneath the tongue. Carcinoma may present as a single persistent ulcer, red or white lesion, lump, or fissure. Also, the lesions may present anywhere in the mouth, including outside and around the lips. Refer back to the previous slide with the picture demonstrating important areas to assess for oral cancer. Usually the lesions are chronic with a raised, rolled edge around it. If there is a lesion that does not heal after a couple of weeks or looks suspicious, please document it and get a referral complete.
So here are some references for the pictures. And now it's time for questions. So I'd really like to thank Kendra and Sophia for providing us with this presentation today. And I do want to remind you that with questions, you can either type it into the chat box, or I'm going to unmute the phone lines right now and you can ask your questions. We also have that link provided to you in your handouts that you can use to go to look at the common questions that have been asked and have answers as well for part 2. Thank you very much.